Okay.
I quit.
Okay. Tripadi.
नमस्कार नमस्कार
Namaskar, namaskar, Tripadi.
Namaskar, sir.
Namaskar,
Namaskar.
namaskar, namaskar. May I start it?
Yes, sir. 45 people have already been joined. We can
Only
start.
45 people. So.
Yes. 45 participants have already joined.
Okay.
Shall we start, sir?
Okay. I'm ready to
Just a minute.
start. Okay.
I will do so.
Okay.
Very good afternoon to respected dignitaries, governing body members of RAV, Guru Janas. Today, guest speaker Dr. B. Shri Kumar, sir, scholars, Shishyas, and viewers who have joined us today in the 195th episodes of Gyan Ganga, a Knowledge Voyage weekly webinar series. I, Dr. Jitika Duggal, on behalf of RAV, welcome you all for today's session. On the onset, we would also like to express our heartfelt gratitude and welcome our mentors who have always been there to guide, motivate, and encourage us for sustenance of this series. Respected Padma Bhushan Vaidya Shri Triveda Trigunaji, President of Governing Body RAB, respected Vaidya Shri Rajesh Kotecha Sir, Ministry of Ayush Secretary, respected Dr. Vandana Siroha Ma'am, Director RAB. Let us begin the session by seeking the blessings of Lord Dhanvantari. I would like to introduce today's expert, Dr. V. Shri Kumar, who is going to throw light on clinical application of Swasthvrita. I hope I'm clearly audible, sir.
Okay. Audible and
Okay,
visible
sir.
also.
Dr. V. Shri Kumar, sir, BMS, MD Ayurveda, PhD REV, Guru, Kerala, Kai Chikitsa, retired Professor Vediratnam Ayurveda College, Allur, retired with Vice Principal Vishnu Ayurveda College, Shornur. Best Doctor Ayurveda awards have been received Vagbhat Award in 2015 by Department of Ayush and from Government of Kerala. By this, I will be handing over the mic to you, sir. We can proceed with the presentation.
Okay. Thank you. Thank you, sir. First of all, very much thanks to Padma Bhushan Vaidya Devendra Trigunaji, President DB of RAV, and then Dr. Vandana Shiroha, Director RAV. Very much thankful and very pleasant for having chance to present this typical topic there. Thank you. And also, I am very much welcome. Thanks to our gurus and shikshas and all members of RAV. Today's my topic is clinical application of Swasthavrta. The webinar consists of three parts I mentioned. One is the clinical application of Swasthavrta. Second is the clinical experience of certain disease with the traditional medicines in our hospital. Third is the single drug therapy of various diseases. That is very efficaciously using in our hospital and is as a traditional concern of myself. Coming to Swasthavrta, this is the first we sanction of the definition of Swasthavrta according to Ayurveda. Samadosha Samagnishta Samadhan Malakriya, Prasanna Mendri Mana, Swasthavrta Fidede. According to WHO, it is also we mentioned here. Health is definition is defined as a physical, mental, and social well-being, and not merely the absence of disease. We mentioned that here nowadays the WHO is trying to add this spiritual health also in the definition of health. That already that is mentioned in Ayurvedic term. Prasanna and Mendriyamana, that is something related to spiritual health. That is important, I think. Nowadays, the spiritual health is very important for the same. On another thing is, it is typical, very much demonstrated that no roga aroga, aroga power as arogyam. That is another thing. But according to WHO, it is not mentioning that merely the absence of disease, not health. It's the well-being of the total well-being of physical, mental, and spiritual, and everything is totally the well-being is the health, not merely the absence of disease. One thing you have to consider that the above statement of health, that the definition of health is only imaginatory, I think. This that may be only target to attain health, not the current. No one is getting now getting this target of health as mentioned in Ayurveda or in the health dimension of WHO. It is attained in Ayurveda for attaining this proper health, or the trying to get this health. Dinacharya, Rithucharya, Ahara Vidhi, Vidhana, Vega Dharaniya are mentioned for attaining proper health of the human. Another thing is, we cannot classify Ayurveda into Swastavarta or Adharvarta. It may be also due to study purpose or clinical purpose, I think. There is one classification of Swastavarta, that is, I mentioned that it is Yadrchya and Fishak Pairidvaridhan. That is the one definition that is mentioned according to my studies. That is, Yadrchya means that the Fishak Pairidvaridhan means the peoples are not living according to most hygienic measures, as mentioned, or classics or tests, or as doctor said. Another, this Yadrchian means they are not allowing or are not considering the hygienic measures of the modern science or anything. They are considering they are Yadrchian. That is two main classification of Swastavarta. That is, one is Yadrchya and Fishak Parivalida. Nowadays, almost 90% of the peoples are following this Fishak Parivarida for maintaining proper health. In Ayurveda, Swastavrta and Adharvrta is interconnected. That is, I think it is to be Samavai. One cannot be separated from Adharvrta, is not can be separated, or Swastavrta can separate from Ayurveda. It is Samavai, and it is considered to be not to be interconnected. Without the importance of Swasthya, any treatment may be incomplete. That is one thing. That is proper following of the Swastavarta, all the treatment that we are concerning or doing in our hospital or our personal hygiene, it will be the one important factor is Swastavarta. That is why in the first stand in the treatment of Adharvarta, first disease we are concerned is about the Jara Chikitsa. It is others deals with Beladhishtanam Arogyam, Arogyartha Kriyakrama. Here, Beladhishtanam, everything is for the immunity or the hygienic conditions, and everything that is mentioned in the definition of Swastavarta. Now I am going to consider a brief details on the Dinacharya from the morning awakening to the sleep at that time, then the Ratri Charya of the last this, and this that also. First we concerned with the Brahma Muhurta of Dinacharya. What's saying? Brahma Muhurta, Brahma Muhurta Uttishte, Swastha, Aisha, Arogya, Sosara Shartam, Aisha. This concern that Brahma Muhurta, the people who are to awake at this Brahma Muhurta, it is a very typical time. That is about 4:30 AM or something, exactly. That time, I consider that the people of nowadays, people of our age, we are not feeling the people, students or nothing. We are not awakening at this period. I cannot not know about the uh, time of Brahma Muhurta. It is very pleasant. Healthy person may awake in Brahma Muhurta. You can see the environment and the climatic condition of that, and that influence permanent speedy recovery of certain ill condition of the body, and the pure oxygen is getting, and we are enjoying this time. For the students we are studying is very better for them, and the people are healthy people, somewhat healthy people will be very encouraging for keep their health in all time. Now we are coming to, after awakening this Brahma Hurda, we are coming to the Shaucha Karma of Ajana something. We are coming to Shaucha Karma. After Achamana, Shauta Vidhi is performed in this context. You have to think about, you may think about this European closet. There is a very first one point for Shaucha Karma. I am introducing whether it is correct or not. We have to discuss or think where it is good or not. I consider that we are using, most of the people of the world are using this European closet, but frequently in India and Kerala they are using Indian closet for the previous after before 50 about 50 years back. Now all are using European, that preferably European closet. But my concern about this Saudi Karma, Indian closet is good because of the muscle and the lower limbs and the hygienic condition of the body. The Saudi Karma is encouraged with Indian closet when compared to European closet. That we have to think about where it is good or not. I mentioned like this. Another thing is the using this Indian closet is the Apana Vayu Punyam. That is very important. For so many controls like menstrual disorders in female and this disease like Abhanavayu are especially concerned with engaged with this Indian closet we are using. That is one thing. Another thing is Dantadhavana Vidhi. Dantadhavana Vidhi, that is very, very peculiar to Ayurveda. It mentioned that Dantadhavana Vidhi, that is very peculiar to Ayurveda. It is only in Ayurveda. Ayurveda Dantadhavana Vidhi is hygienic, economic, and clinically it is effective for so many dental diseases for cure and management. I think the origin of modern toothbrushes from Ayurvedic Dantadhavana Vidhi, that is a Sugurucham, Dodashangulam, and such this the particular. No, I think even a millimeter of the length of that mentioned arrow is not changed in modern toothpaste. They are using the same. One thing is they are using the plastic that is not hygienic. Some particles may be coming inside our gut, it may cause in future some disease. So I am not preferring to use this this toothbrush. It is hygienic that you are mentioning in Ayurveda. That is the way I am telling that the origin of modern toothbrush is from Ayurvedic Dantadhavana Vidhi, where in certain condition Dantadhavana Churna is also used, as in mentioned in Bhava Prakasha. In Kerala, I think for the last 3 years, for the 200 or 3 years back, our grandmother, father, and everything, they are using charcoal and salt mixed tooth powder or tooth paste for this Dantadhavana Vidhi. And think that my grandfather or our grandfather or mother, they are having till their death, they are having full teeth on their mouth. Now the peoples are going to the dental hospital for treatment day today for this hygiene or dental. That I think it is not so good. Dantadhavana involves employing herbal stick such as Kashaya Kadu Tittarasa. Kadu eliminates all plaque. That is very important. That Kadu Rasa is very effective for this plaque removal. But Tittarasas work on Pitta Pradhana. This help dental and gum health. This help dental health and gum health. I think about the 53% of India, about 50% of Indians suffer from tooth problems such as bleeding gum. Suffer from tooth problems such as bleeding gum, foul breath, sensitivity of teeth, receding gums, and decaying teeth. The daily usages of this Ayurvedic Danta Dhavana Vidhi and Jihva Nirlehanam promotes oral health and hygiene. I think in this southern, the northern states of India, they are using, in Ayurveda it is prescribed so many stick, trigger using for this dental dhavana. In this southern, northern states, they are using properly of Nimba tig for this danta for tooth experience. That is to be having Kadadikta Rasa Pradhana, I think. After this, Jihva Narlehanam and this tooth brushing, Savvira and Rasanjana Prayoga is preferred. It is effective for in eye disease, preventive and curative aspects. These two Anjana Prayoga. Doing this early in this morning session. One thing I mentioned in this concept that is not mentioned in our Dinacharya of Indian classic, Tarpana Prayoga is very big. In Kerala, the peoples at this holidays, this Onam holidays and December Christmas vacation, people are coming and to our hospital for this Tarpana Karma. For I think the people, these students at this age are suffering from this short sight. The short sight that can be controlled by the Sanjana Prayoga and Tarpana. And I think this Dinacharya, this Tarpana may be also not in the daily use, but in about 15 days or 1 month's duration, have to do this Tarpana. It's effective, I think, for the hygiene of the health, the eye health. Kabala and Gandusha, Tambula for any rogas. This is the next step after this this Anchana Prayogam, Kabala and Gandusha. Asancharya Mukhe Gandusha Kabalo Anyada. This is a term. We are used to it in Kerala. In our hospital also we are using Kabala and Gandusha with Ayurveda Thaila. I think it is the Ayurveda means the bubble. The toothpaste is available now in bubble toothpaste. Here we are using this Ayurveda oil prepared with some medicines for Kabbalah and Gadur. This is very effective for Asya or stomatitis, foul smell of the body, gingivitis of the gum infection. So many diseases are completely cured by this Kabbalah and Gandusha. I think it will be maybe very good for the muscles of the face muscles to be activated and will be good for the same. And the Tambula Tarvanam, that is special, that is in all states of India, they are using Tambula Tarvanam. It is very important for this Lakshmi Prasada and this false smell of the Asia, the mouth. And this, I think it will maybe for oral hygienics, this Tambula Tarvana, that to avoid this tobacco. With the tobacco, it is not preferred, only tambulam, it is very pleasant, it is a Aishwarya Pradhan also. Then coming to, after this, we are coming to the Abhyanga and Uddartana, better for, it is for health maintaining. And after this Abhyanga Karne ke baad, this sunlight, exposure to sunlight is very good. It will be for absorption of vitamin D. We are depending other pills like vitamin D is required, or the doctors are testing the biochemistry of the blood. They are prescribing vitamin supplement externally. I think it is not so good after applying the oil, a medicated oil to the body, and the evening, it exposure to the evening sunlight, it is sufficient to absorb. The skin absorption, you will get sufficient, I think, to get the sufficient vitamin D for the same. That is the next is the after the Abhyanga as explained above. Vyayamam, you can have Vyayama like Prabhata Sancharam and yoga that are better for lifestyle diseases. After that, we are attacking this Snehanam, not Snehanam, Snanam. It's the last thing, I think, for this Dinadidia, for the speedy people of the employees and students. The last is the Snehanam, the Snanam. That is both hot water the body and the cold water for head. It is Divana, improves digestion, or it maintains this health. Is it doubtful that so many Dinadiria processes are mentioned here in our classics? I think that how can a speedy life in our nature? Students' classes will start from 7:30 and the employees have to go to their office about 9:30 or something. How can you do after these things in a particular way as explained in this case? I think it is explained. Time chart. You see that you awake in the Brahma Muhurtam, and doing all this particular time to be divided in those, you can see all this explained above can be completed within 7 a.m. And the students can go to their school, the employees can go to their office in proper time with healthy and full pleasant, with a healthy and the pleasant mind. All activities are encouraged and speedy. It is good for. This have already mentioned a chart in the slides here. That is, one is wake up between hours of 4 a.m. and 5 p.m. 48 minutes before sunrise are supposed to be the purest of the body. Be sure of eliminate the body waste produced down to avoid illness. Like this here, 1 to 2 drops of Anudayla in the Nasya, also are mentioned here. It's all completed. I think you will try, will complete this process of Dinacharya will on about 7 p.m. Then it is Satvrta. According to WHO health definition, social and spiritual health according to Ayurveda, that is Prasanna Mana. That is means avoid following that mentioned the Sadvrta and avoid Dashavida Pavas. That all are mentioned for this Sadvrta. Acharya Charaka in Charaka Samhita prescribed rules and regulations which one should follow on routine life. Saturta is also one of them. It gives details knowledge about the do's and do not of the life and also ways of living. It is also an important method in our prevention of disease. Term Saturta is a Sanskrit term which originated from word Sat, which means good, and Vrta means of behavior. So, Sadhurta codes are applied on all age group of people at 24 at all the place in place an important role in clearing our internal channels of body, which gives comfort to our brain. I mentioned this Arthurta with a modern science about the and explained one word in this Bible. Christ already advised about this. You love the people, the people others. That is, love the people, the neighbors, as you like yourself. That is an important thing. I think in the Bible, the altogether principle that is followed in the world is this Swartha Buddhi Parartheshu. Paryaptamati Saturta. Whatever the Saturta explained in any class, any religion or anything, Swartha Buddhi Parartheshu. As you love yourself, you love to others. That is, or the neighbors means to others, except you. The world wars can be controlled, any quarrel will be controlled, any family matters will be controlled, everything will be controlled, nothing will be in soft and in pleasant and comfortable, happy mode in the world and the life. That is very important. Ashtanga already correctly prescribed this Sartha Buddhi, Parartheshu, Paryaptamati Satyurtha. Nothing will be neither. It is already, I think, in Bible itself, we can see. In Malayalam, നീ നിന്റെ അയൽക്കാരനെ സ്നേഹിക്കുക. That is in Malayalam. Another thing is, all the people, all the living people in the world likes Sukha, Sukhartha, Sarva Bhutana. Sukhartha, Sarva Bhutanam, Mada, Sarva Pravartaya. All religions, all people are doing likes this Sukha. For attaining, another thing is Sukha Vina Dharma. Sukha Vina Dharma. Without Dharma Anushtana, there will be no, as it is explained in Bhagavad Gita also. Without the Dharma Acharana, no Sukha, no pleasure, no happiness will to anybody, with human or in the world also. So, Tasma Dharma Paro Bhave. Because of this, without Dharma, we cannot get happiness. We should keep this the Dharma Adhisthana Pravarta. This is explained in important in Bhagavad Gita, and it's in Ashtanga or it's main in our Ayurvedic classics also. I'm mentioning now, explain some things about this clinic, about the aim and something about this Swastavrta. I already explained the definition of Swastavrta in here. Swastavrta is a branch of Ayurveda that focuses on preventing disease and maintaining health through a holistic approach. It emphasizes a healthy lifestyle, diet, yoga, hygiene, and includes daily and seasonal regimens. About coming to my topic, clinical application of Swastavrta, that it prevents the disease through a healthy lifestyle, diet, yoga, and hygiene. The second is the suggestion of daily routine, such as Dinacharya, Rithucharya, Ratricharya, diet and Sattvarta also. It also prevents mental diseases, Sharirika dosha, such will be controlled by this. Second is the removes toxins from the body through Panchakarma. This Panchakarma is also an important thing to mention in our the Swastavrta. Purify the body by using herbs and rasayanas. Rasayana is so many herbs and ahara vidhi are mentioned in the body for us rasayana. This purifies the body by using these herbs and rasayanas. Another is a lifestyle modification can help to cure diseases. That is then the life. This sentence we are explaining now. After this, seasonal purification will help people live long and healthy lives. Can help gain bigger and aging also. Aging can be controlled before aging is controlled. Then something about I am explaining the lifestyle diseases and the cause of like this. Lifestyle diseases are those whose occurrence is based on people everyday behaviors, and arises from the improper interaction between people and their surroundings. In total, I think the Paragarivirutta karmas that we are doing is one thing of the lifestyle disease. As an improper interaction between people and their surroundings. Another thing is a person's complete well-being, including their body, mind, and sensory organs, etc., is referred to as Swastavrta. The Ayurvedic daily routine, season and regimen, Sattvarta, eating requirement, rasayanas, sleep regulations, and Brahmacharya all provide detailed description of how to attain proper health and hygiene, that how to attain the Swastavrta definition as we have mentioned above. In the case of lifestyle diseases, nowadays people are calling these diseases in our life. These lifestyle diseases are not affecting the early 100 200 years back. This is not that was important, not very common. That means the people calling the lifestyle diseases are in our life. That is thing I happen. That is the meaning that the lifestyle disease is due to the change of lifestyle that was we are enjoyed previously that years back. That people that enjoyed was very happy, pleasant, without having any lifestyle diseases like hypertension, diabetes, obesity, cholesterol, anything, nothing. You can simple 1 or 2 or 3% or some less people are coming to our hospital or to mention there. I think these people are, I think, our grandfather or grandmother, or we are not approaching any hospital or the need for to any dental hospital or any any treatment needed because of their life, good lifestyle, especially in Kerala, that is followed people, I think, in this case. The reason, one thing, some examples are I'm giving how these are change the healthy life we have purposely called for calling for our life. One thing that we are using this now, we any harm, even poverty or any, they are using the one main important thing is the washing machine. The another thing is the mixing. Every home it is available now. It will be very harmful lifestyle. The people at the olden age, they are using this stone grinding. You imagine that this stone grinding, pasting this by in Kerala, it is amme kalle. It is not using. You get a better exercise. And this lifestyle disease, hypertension, obesity, everything over. Another thing, so use of mixie, washing machine. Another thing is clothes will be bathing at the riverside by stone wash. This can be, is not can be imagine the people of this modern age. It is one thing. It is avoided that. One thing I forget to send in said in this Dinacharya, that is in Danda Dhavana Vidhi. One thing I forgot to mention. I think it is very too late. I think very late or too late. It to start dental course like BDS. That is BDS in Ayurveda. That is Bachelor of Ayurvedic uh, Medicine and Surgery in Ayurveda. It's too late. I think in our, I mentioned that Dr. Makhana, yes, doing miracles in the field. You can see in the webinar, and so many things I mentioned. I think that is a miracle, I think, by Jalandhara Bantha, the extracting of tooth. And the Kashiva Samhita, you mentioned that the disease and disease causing dental diseases and the extraction of tooth and this Dantaharsha cavities like this already controlled by these Ayurvedic people, Ayurveda doctors. That is, I mentioned to suggest the things for the authorities to start a BDS in Ayurveda by in cooperation with the Council of Ayurveda and the Ayur System Ayush Ministry. And I think it will be some effort. It will be taken by the RIV, as we are. This RIV is doing so many better things for the hygiene and the hygiene of the people. I think it will be sure that the RIV will be starting to start this BDS course in our country as early as possible. I think it is too late, I mentioned. Those PG courses or this research works can be done in this field. This first part is over. I'm coming to the second part. In the previous, I think the first or second webinar I conducted about this certain diseases. Yeah, that is conducting successfully about 98% result in our hospital. I mentioned once for the newcomers and new shikshas. One thing they are properly and very successfully treating in our hospital for more than 10 years, and in our personal treatment about 20 to 30 years. One is grithrosy. In modern times, it is IVDP or the disc prolapse. The Nidana and Sambrati are not mentioned in the text so many times. It is I have to say so many things in this case. That's simple methods. I think diagnosis is important for this disease like grithrosy. What only mention is the walking nature of grithra or the vulture is a proper is important for primary diagnosis. Then we can do after this primary diagnosis, we can see the radiological things like MRI or something. We can do see that it is prolapse that is mentioned to be grithrosy. Or the another thing, the severe pricking pain of the lumbar region radiating to feet. This is the I can mention that it may be to grithrosy. According to modern, it is IVDP, and our treatment starting this case is in modern case after conventional treatment they are preferring to the removal of the disc or the surgical method is preferred. These cases are coming to our hospital for better treatment after this consultation and treatment with the modern medicine. The treatment that we are doing, briefly I am explained here. One first we are giving, you see in the slides, Snekhavana with Gugulu Tikta Kridam. Till the Samyak Snikta Lashna is mentioned, is achieved. Then after the medicines prescribed for the Snekhavana for Grithras is very better I consent for selection is Gugulu Tiktaga Kridam. Then after Samyak Snikta Lashana of this Abhyangam and Sneha, Svedana karma is doing. This after Snikta Sinnatvam of Snehvana and Abhyanga and Sveda, we are attaining the patient is at Snikta Sinnatvam. Vamana is applied on scientific methods. I think after this Vamana, we start the main treatment like special pottery for 7 days, prepared with Shiguru bark with Saindava. That is the peoples are in all the peoples at the hospitals are using patra powder cell. That is a Vadahara leaves are mentioned for this patra powder cell. That I am not doing this. Prepared, the bottle is prepared with shiguru bark and slices of bark mixed with the saindava and make it a sponge-like thing and make a pottery. And the oil that is mentioned for this special pottery is Kai Tirimeni oil. That I mentioned early Gritrasi webinar. This is a very special medicine. Now it is common. It is a very special medicine that are using and prepared in the southern districts of Kerala. That is the peculiar style of Marma Chikitsa. That kind of this Kayatirimeni oil that is used for this special fertility for 7 days. Now, along with this traction, lumbar traction is used along with this treatment. And briefly, setting after that, you are using Vaidarna Vasti for 3 days as described in Chakradatta. And also Siravedham. Siravedham is applied for 3 or 5 days as described in Sushrata Samhita. And Last that is Agni Karma in the small finger of the feet that is applied. I think this altogether it will getting about 13 to 14 or 15 days that it is taken for this complete treatment. One thing is that within these limits, about 90% of whether severity or non-severity are better when they are happy, the God self, they are improving and better life, they can keeping better lifestyle in after the treatment. That is Kritrasi. The brief discussion is about the treatment that we are doing now. Another thing is and this Githrasi are using Indian medicines like everything is using. And one special medicine that using is with along with the treatment, Nirgundi Aranda. Nirgundi Surasam, Aranda Thailand Samyuktam, Saptaratram. For this person, this is Tilsa Mandiri of Kerala speciality. Second disease I mentioned is psoriasis. People are so many medicines that can, up to this case, the modern case, it is not curable with their medicine. People are approaching these Ayurvedic doctors, people, for this better treatment. Maybe for certain selection, certain time, typical cases or varieties of psoriasis, we are mentioning some cases are coming to our hospital. Let us I treated a person. Photograph is available. Uh, you see the photograph in the photograph of in the slides. A female about 23, 28 about something age. He see some photos here before after the treatment in at our hospital. I also very surprised to get this in a stipulated time. Their marriage was over about within for about 1 years back, and it was very difficult. And this case, so we are treated now, admitted in the hospital, and we are treated with the medicines that treated and the whatever the medicine use. We can mention this case with about this 90%, 90 to either 90 to 90 95% result, and no recurrence also. That is another thing. Here, what we have done is Snekavan with the Aragga Mahadikta Kritam. Till Samyak Snikta Lashana is achieved. After that, Afyanga and Sedam for Snitha Sinnatum, and the Vamana is conducted with the proper scientific method. After that, this prefaces the internal medicine like Arogya Varthini tablets 1 Resasantura tablets 1 Raitia oil 10 drops daily at night, and the Abhyanga with the Raitia from Raitia tintosa. That is and Nimba the oil. The prepared with Nimba the oil, a special medicine prepared with Nimba patra and Bakuji Kalkam. Soria cordifolia. Along with certain times, Yala the caram also when the itching was there. I think I'm proud to say that this case very result oriented to us. It can be used for other people or try this case for the same. Another thing we successfully treated in our hospital in the previous 3 years back was cellulitis. That is Nadi Vernam. It was treated with so many specialist doctors of our state, and coming back to our hospital for treatment, they are preferring. I think it was next stage was amputation of the leg. You can see the slides, the picture of this, the photograph. And after that, what is happening? It is a miracle, I think. I was also surprised to see the last what happened this case. This miracle relief was noticed. A treatment I had done was Jaloka Avacharanam for 5 days. For 5 days with 5 leaves every day. And that Shalanam with Triphala and Nalpamaradi Kashayam and applied Datyadi Karan. Indian medicine is your Arogya Varthini tablets 1 Mahamanjishtadi Kashayam 15 ml BD, Rasasunduram tablets 1 and another is Siddha Magarathujam, that is a gold mixed Magarathujam that was given every day for healthy and for the circulatory defect to be corrected. Special medicine given, that is we have given, it explains how much I think this special medicine given for this cellulite is Pav Kanni. It is a pure Kerala medicine. I think it is my family medicine for the last 30 to 300 years of our family is using this Pavaganji. Not the doctors or physicians are using. It is not my notice. Pavaganji is it is a powerful antibiotic. I think the thing that is the preparation I am mentioning for the Ayurveda people, Ayurveda world, for their better treatment. That is only is the important is Madhusiniki 2.5 gram and Mishi 1 gram mixed with boiled red rice water. That is Chennalari in Malayalam, taken for 1 month, early morning. That is the Pavaganji. This can be applied for this case and for this wherever this antibiotic is necessary. One thing is that in this case, the strict dietary restriction was followed and vegetarian food was preferred, and these are cases. This is a psoriasis. You can see the picture in our slides. Another thing we are treated successfully was the nowadays we find this case carpal tunnel syndrome. As you know that every doctor we are approaching to the modern science, they are suggesting it's a simple operation. I think within 15 or 30 minutes it's over. Anyway, it is they are selling about it is a surgical measure. We are having a special bandage with a special labinum for 7 days. 7 days. Surgery can be avoided. No reoccurrence after 1 month. 11 no occurrence after 1 month level of medicine with lab Grihadhumadi Churnam with Marmasara labum, that is Kartavata. That is also special medicine. That's Kartavata is also a very special medicine that we are using in the southern states of Kerala. As a marma, not other states it is not product. Karthavat is a very effective medicine for edematous condition, swelling, marma figada, sofa, everything. And the simple. Not all are mentioning that this Karthavat is medicine in Kerala. The doctors say that I think the doctors are even now known about what is Karthavat. This Karthotex is the medicines of Sanninayakam in Kerala. Sanninayakam. It is alkaloid separated from aloe. That is Sanninayakam, aloe vera. That mixed with arrowroot powder. That much, it is 2 medicines is there. Nowadays, there is Karthavat means only simple medicines. The main ingredients is the, this case, the Sanninayakam. Whenever a small, not fracture, some marmafigata or some afigata happening, this in people in Kerala, first they are using Sanninayaka Lavanam for Kerala people. Another thing in Kerala, in our state, we are using is the treatment with the successful was the osteoporosis, knee joint. I mentioned the medicine that used for the lavina in carpal tunnel syndrome. For the Ayurveda world, I am exposing this carpal syndrome. the special labinum with the bandage that we are using in our hospital is made with the moringa leaf. One is moringa leaf, mira, saindavam, kartavatta, as you mentioned, grahaduma the churna, raw egg white, made lavana in Thanyamla. This is the formula that we are using in our hospital with better result. Another thing I am mentioning, osteoporosis, the knee joint. That is maybe due to osteoporosis something. Here also we are using special Upanaha Svedam for 7 days, Thanyamla Dhara for 7 days. Internal medicine usually is Gugulu Tikta Kashayam, 50 ml BD, Karpas Karaskaradam, 1 teaspoon BD. This Karaskaradam is, I think it is very special to Kerala. They are in Trivandrum Ayurveda College. That is it is a common medicine that you are the knee joint inflammation, pain, and this osteoporosis like with a better result. And this Karasagarda bark with boiled with water, Karaskara bark is for this thara also and used for this osteoporosis of the knee joint. That is the thara with the bark of Karaskara. Anyway, you can try this for 7 days or 5 days with some special medicines like Guguludikta, Karasaradan. We can avoid or replacement of the knee joint. The suggestion step is only the replacement by with the how many cost about 5 lakhs or something. It is very affordable to common people. People are coming into our. I think per day we are having 5 to 10 cases of this osteoporosis knee joint, and we are treating with the great success. Next is the breast cancer. This is purely of my family medicine. Yes, used by father was a graduate in Ayurveda Vaidya Garanadi in a family medicine using for this breast cancer with great success. Is now in our hospital we are using this medicine and we are considering is a breast cancer this as a special research treatment for the same. I've already sending this paper to the ICMR, I think, for the further research matter. This special treatment is going in our hospital for breast cancer. The treatment I am setting here also. First, in our family, this Pavgani was used. He was this, I think, I remember it, is for breast cancer. Whether it is acute, chronic, or any condition, father in our family were treated successfully with the following medicine. That is the Pavagani. I think it will be effective. It is a powerful antibiotic is considered to. One is it the yoga I mentioned in the slides. This Pavgan is you given to the patient for 21 days to 30 days with a strict diet restriction. Only vegetarian food is advised. After this is 1 month's treatment with Pavgani, you are treated with Kaisura Gugulu. We prepared Kaisura Gugulu. That is the thing we have done our home. That is the Kaisura Gugulu prepared. That at that time of preparation, it is a very gummy nature. At that gummy nature, we add Abraga Basma with a particular quantity, and the Rasasandura is added, Abraga Basma, and the Sarpa Ganthaga is added. These are mixed with and make a small tablet. And is given with the honey for 1 month or 2 months. Within 15 days, we are getting better result for this breast cancer. We can try it anytime. Another thing is the medicine given is Gugulu Panchabalam with Matusnugi. Gugulu Panchabalam is Matusnugi for 1 month. I explained my experience for this case of Gugulu Panchabalam with Madhusunugi. our hospital experience and my hospital research. So traditionally we are used. My father was frequently used this Gugulu Panchabalam with the Madhusnihi, with the honey uh, for the frequently coming the sinusitis. Sinusitis can be controlled with the modern medicine with antibiotics, but we are giving in our hospital with this preparation with success, no recurrence is needed. One thing that remember that Gugulu Panchabalam is prescribed in our classics for Bhagandara. Bhagandara, Gugulu Panchabalam is prescribed. But we are using in Bhagandara also in a modified form, that is Gugulu Panchabalam mixed with Madhusunik is used for this fistula. A fissure, and like the cases with a good result, can be with certain cases can be avoid this fistulectomy. This one thing. This one single treatment for this case we can try it. This is also a surgical method. This for this hydrocele paste of Lata Karancham. That is a Thanata Nayanam in Sanskrit. In Malayalam, it is Karanchi. This is mixed with alcohol. It's applied for 7 or 10 days. In the affected part of the hydrous, it is cured with gradually cured, completed with thing. This is the second part of my topic is over. Last, I am mentioning with some single drug therapy. Is the Euro that is my topic in my that is that is may or not be correct this and described in Ayurvedic classics, only the botanical description, that is Scoparia dulcis Lin. This is our PG studies. My guide was Trivandrum Ayurveda College principal, Dr. Fasil Marakar. He is no more now. Well, sincerely have with my guide for this PG studies in Ayurveda with the my co-guide. Thing is that we have tried this in Kerala. The colloquially it is used. The kalka of Scopia. You see the plant. You see the plant in our slides. These are all in Kerala. When we visited Banaras University in the premises, it was this is was abundantly there we have seen. There we are not using for urolithiasis, but they are for this sleeplessness. They are using. They are mentioned that. This is a plant used for this. What I think in our course of our PG studies, about 3 or 5 stones, somewhat big, was spelled out. That is important. But the thing is happening is that the Dr. Hassan Marika, my guide in medical college Trivandrum, he has mentioned that after finding all the biochemistry of my research work, he mentioned that one thing you can gain from this research is it is a very powerful drug for this uric acid. It is mentioned that the direct better like in modern medicine, he said that is siluric. That is the modern medicine they are using to reduce uric acid. In our BG complete about 20 or 20 years back, I completed my 3. We are this time we are using according to that is as my guide. You are using this guide, this calca of these plants, Scoparia dalcilin. Uric acid is conserved and anybody can be tried for this case. Yes. The first things the edema of the knee joint, the carpal bond, the feet, and everything. That's this and this case will be completely cured with the kalka taken in the early morning time. Another thing that is we have noticed for vertigo. In so many medicines, I think mentioned in our Ayurvedic treatment for vertigo. Anyway, the peoples are common there for vertigo is modern drug like Vertin tablets or something for lifelong time. They are using this modern medicine for vertigo. It is very common. I think it may be psychosomatic conditions also I meant to mention. In the case here, you see the picture of in the slides, dusparsha, trachea infiltrata is 50 grams root or a samula boiled with 1 liter of water, filtered and taken many times a day for 1 month. I think I guarantee that within 1 month, 1 month of treatment, then the vertigo will never happen in these people. That is a very the thing I'm mentioning that. That is very, very important. Anybody can treat with vertigo, with dusparsha, with trachea.
You carry on.
Yes, okay. This is for about for 1 month. 1 month use, we can use this treatment. Vertigo. There is a history, a story behind this use of dusparsha in vertigo. That is my study, my classes when you are on studies in the Ayurveda college, teaching in Ayurveda colleges. There is a thing in the um, syllabus of BAMS that is 10 cases to be reported every year for this for research for the single drug therapy. I once selected, I think it was this Sparsha and the column for peoples about 20 or 30 peoples. For the conservation for the relief, I got better result. I find this result and advised my students in our college, at the college, to do this plant. It's very effective and can be used in future course. Try this. That is the thing we are doing. It's very effective for vertigo. You can try this first. That is coparia. It's not practice. This is trachea in your character. There's another thing, another single drug. Caloric is the, I mentioned, asthmatic property of caloric. Another single drug that are used in for this lithotriptic action of urolithiasis is gokshidaksharam. It is also a purely a traditional family medicine, gokshidaksharam. 2 or 3 grains with water is used for this. Another mention now we are using this Yelamulachi plant. Juice of elemolate is used for the lithotriptic action of this case. This is Suryavarta. I think it is mentioned that this is Kantari leaf in is kalkam. That is in the botanical name. You see the plant in here. That is capsicum annum. That is the plant, the small capsicum. This is not this capsicum is not using for this purpose. Suryavarta means all the Ayurvedic people know that it is started from the before the sunrise and aggravates at about 12 p.m. and subside after 10 p.m. or 3 p.m. No headache is there. This usually is known as Suryavarta. Is a gradual increase of pain from 6 p.m. to 10 p.m. 10 then it will be so after this evening, it will be not there. This is the action of the preparation, and the leaf is collected and make a paste and applied. Many of the cases I seen that Suryavartam pain of the Suryavartam is one side of the this forehead. One side frequently. It is your head with an analysis, with powerful analysis, it cannot be controlled. But within 3 days of treatment, 10% result is getting. No things to be applied. Don't think about this thing. Within 3 days application. This application, the lavana of this paste and apply to the nail of the opposite side of the pain forehead of the feet of the nail with the big nail is over the nail and it will be completely washed away evening. This time are giving 3 days. It will be applied on things that it will, before sunrise, this to be pasted on the nail. That is important. Very, very important. This time and washed away after evening. Alka. This is 10% result is getting if it is Suryavarta. In the classic, there is so many yogas and which are explained. We are not giving any oral drugs for the same. That is another thing. Only this lavana is used. No oral medicines or everything is. That is Suryavarta. This leaf paste is also for the nasal polyp. This is common in the children. Need to be pasted or the nose, and a plaster is to be applied above this, it not to be removed. This curtain over the nose for 7 days. It is very effective for this nasal polyp. Another effective for 10%. It's a very surgical method. Nowadays, we are using with the about 1995 result. In Ayurvedic term, that is a disease is the rectal prolapse, Gudapramsha. We are also we are not using this oral drug is only small simple drug is for use. Main treatment we are doing is with the Katapa in Malayalam. With the avagaga sedum and the lavana or the nasal, the rectal prolapse. The botanical name is aquatrium. Only conicides. Cotton conicides is the katapa. It is in all over India. It is available with a small yellow flower. You can see it in the picture. This I think it is not clear. It is another single drug we are using with great success is for the fibroid uterus and all the gynec disorders. That is perivelum, herbal root mixed with the preparation I tell you. This is the perivelum. You see the flower. It is available in, I think it is available in all the states of India. Perivelum. Clerodendron is the botanical name. Where the root is used for the purpose of fibroid uterus of any size and is for the gynec disorders. The preparation I am setting, it is also a traditional medicines of Kerala. That is first about 5 grams or 10 grams, about 10 grams of the root bark is collected and paste it, to grind it into a paste and add with shastigam and made into a bolus or idli. Idli is the food material of Tamil Nadu and Kerala. And one idli or one bolus after prepared in steam with herbal drugs with the shastigam used per day for 30 days. After this use is mentioned, you can see the size of the fibroid will be reduced. This is perulum. It has lot of single track action for Suryavarta. The paste of leaf is also applied for the thumb nail for 3 days for Suryavarta and many reaction. It is now, it has got some patent in Trivandrum Medical College for the cancer, cervical cancer. It is tried for an MBBS doctor in Trivandrum RCC, Regional Cancer Institute, and got, I think, got patent also. But the originator was a Swami. He is a great scholar in Kerala, but he is no more now. But after his death, he has got patent in this case for cervical cancer. It's very effective. The root is important. It is prepared is the appam, prepared into appa and used, or idli making and using for these gynec disorders. Then another is jaundice. Jaundice, you see that the plant, this is not plant, it is a jaiva. Shank is used. It's a family drug of some families. The shank is made into paste with water in a stone, like this chandana preparation. Mixed with a half glass of milk every early morning for 7 days. The one thing is that no diet restrictions needed for this 7 days, which is serum bilirubin will be coming to the normal between below 1. That is one thing. We are giving the medicine after testing, before and after testing, 7 bilirubin 7, 10, 18, it will and asadhya condition. We treated the blood, the urine is in blood color like this. We are using this paste of this for better relief. You can use. Another medicine that used for Kamala is the Eclipta alba juice or paste for 3 or 5. This serum bilirubin cases, the juice is used for this Kamala, jaundice, hepatitis, early stage of cirrhosis along with the other medicines they can use. Anyway, Eclipta is a better hepatic stimulant. If a loss of appetite is complaints with people, with the children, we are using this juice of Eclipta alba, 2 teaspoons daily with honey used with better result. Thank you very much for all you are listening my humble, simple presentation. And all of I appreciate and thanks for all of the RIV members for getting a chance to present this material.
Thank you,
Okay,
sir.
thank you, sir. Thank you, sir. Thank you, sir.
It's been a very informative
question,
session, sir. We have a doubt in the chat box, sir. It's by Dr. Kajal Babar that when to give Vaman in Gradrasi. Or is there any case in which Vaman had been given? Can you elaborate it?
Vamana in Gridharasi case.
Yes, Vamana is Gridharasi case with my experience. Every I meant a lot of Gridharasi cases now also, in today also in our hospital, 5 patients are admitted for Gridharasi. We are giving this Vamana is used for a better result. This is my experience. In classic, I don't know. Classic, with Vamana, it is better, I think. Imetazine can be used. I think this course of treatment I mentioned for Gridharasi is in that term that you can be used. Also, Snehakavana, Vamana, that is Ubhaya Shodhanam. Not we are doing Vamana, the Virajana is also doing. That is Ubhaya Shodhana is done. Then only after this Ubhaya Shodhana that we are doing other treatment and Patra Porla Sedan, Portly, everything so was there.
Okay, sir. Thank you for clearing
Okay.
that out.
Sir, next
Sir,
question.
one more doubt is there. Please explain Pavu Kanji preparation. As you already said, it's a traditional preparation, but I think they want to know more about its preparation and the ingredients.
Somebody is asking the preparation of Pavu Kanji.
This Pavakanji is mentioned. I am using about last 50 or 70 years of time, not 70 or 50 years of time. We are using Pavakanji. That is only the preparations. My father has mentioned this when they are using this Pavakanji. Nowadays, I am thinking about set or practice is Pavakanji. Anybody powerful antibiotics or like this cellulitis or like these cases is needed. We use Pavakanji for 1 month time. The drug mentioned is only Madhusunigi plus. Pardon?
Sir, they are asking for preparation of Pavu Kanji. How to prepare Pavu Kanji?
The preparation of Pav Kanji is very simple. Kanji in Malayalam it is Kanji. Yavagu. Kanji, Yavagu in that is mentioned. The only medicine that prepared is Madhusunigi plus Mishi. Mishi is 1/4 Mishi plus this Madhusunigi. This is added, this is mixed with the hot rice water. Chennalari. Shastika, not Shastika, this Chennalari. The rice water. That is used for 1 month's time, it is used. You know, I mentioned this is a particular medicine for breast cancer. It can use such conditions in the body. That is, it can be used if the fistula also. That is, I mentioned that this what we mentioned. Majusuni, the Gugulu Panjavalam with the Majusuni is effective. Anyway, it is now named as the Pavu Kanji. Then,
Thank you for clearing that out.
okay. Any questions, sir?
Abhilash ji, very good presentation. Very, very thanks.
Thank you, sir. Tripadi ji, we are very happy to see you in this. Very, very happy.
बहुत ही विस्तार पूर्वक वर्णन किया रोगों का अलग अलग ढंग से आपने चित्र व्याख्या दिया.
Whenever coming to Delhi, we are frequently seeing and you are getting advice from you. I am very, very happy, sir. Seeing.
आपसे मिलेंगे.
Okay.
और कैसे हो आप? How are you?
Okay. Fine, very fine. Healthy and happy now.
Yes. It should be.
You still remember me?
ठीक. Thank you. शुभ रात्रि. आपको अभी बोल देता हूँ.
Okay. Surya ji, Surya Prakash ji, I am frequently in that bus we are seeing and having advice from you.
Thank you.
Your beard is, I always remember your this white beard.
It's natural one.
We are going to from our hotel to there with the same bus.
ठीक है.
About our presentation, what about my presentation onward?
Very good.
आपने कुछ मेडिसिन डॉक्टर साहब केरला में मिलती, यहाँ नहीं मिलती. हम लोग जो आपने मेडिसिन बताई है वो यहाँ पर अवेलेबल नहीं है हमारे यहाँ.
बहुत सी जड़ी बूटियां केरला में मिलती है, रेस्ट ऑफ इंडिया में नहीं मिलती है.
One habit that remaining and keeping is that these what are the medicines that treatment medicine is my family medicine. Most of traditional my family. I am not hiding anything in my life. I am already exposing to my students in my college life. Everything is giving to my not secret, not hidden agenda in my life in the field of medicine, Ayurvedic.
अच्छा,
People can use. People can use.
आयुर्वेद में
और जो होता है ऐसे नपवाली तो पता चलता है ना।
आप औषधियों का चयन वेद मंत्रों के साथ करते कि नहीं करते? वेद मंत्रों के साथ औषधियों का चयन।
They are asking, do you collect the medicine with the mantra ucharan and everything?
Mantracharan, I think that in do to the art to my treatment. My advice from my father is Vaidyalandati from Trivandrum Ayurveda College. My totally 3 Ayurveda physicians, my grandfather, and I think it's about 200 years of practice, traditional practice, more than 200 years. The answer is that I advise is that mantra. That we are using, I tell you, my position is that whatever the very simple disease or very acute or chronic treatment, I think whatever the medicine are giving will be with the memory of God and my father. That will be the success.
No, there is
I'm remembering my father and my God, remembering my and this God. Everything will be getting success.
But
Without
your
God,
name is Abhilash
without
Joseph.
God's nothing. Without God's blessing, nothing. No treatment will be completed. It is my 76 years of experience. Nothing will happen. I think I surely said that without the help of God, with the right sight of God's presence, nothing will do in the field of medicine. Ayurveda, Ayurveda full of God. Without God, nothing will happen.
correct.
सभी को प्रणाम. Thank you, sir, for nice
Okay.
technical presentation. For
Okay.
all the guru.
Namaskar.
Thank you, sir. On
Thank you.
behalf of the organizing committee,
Excuse me,
I would
excuse
like to
me.
thank- Sure, sir. sure.
Hello. Excuse
Okay.
me, madam.
Yes, sir, please.
Sir, Joseph sir, Abhilash sir. Hello.
Okay.
Are you?
You are audible, sir.
Am I audible, please?
Yes, sir.
Yes.
Just, sir, whatever your experience, have you any publication in the form of book? Have you published anything from your family or from your side?
I have given 2 small books on traditional medicines, small books only in Malayalam, not published, not such work. I am giving is only teaching the Ayurvedic people that the thing not published, the people doing, I think this more important to this only teaching and experience will be given to my students and teachers and everything. It is a great success. I am enjoying this with this.
No, whatever the sir, whatever the books from your family, where are they available?
In Kerala only, the small books, I think. For the publication needs, I will send to the RAV for publication to the RAV. It is a great advantage for the Ayurvedic people and the Ayurvedic science. I will send it to the library or to the RAV. I will send you.
Sure, sir, sure.
That is surely I will
Okay.
send you.
And we all.
Okay, thank
sure.
you, sir. Thank you.
Okay.
That will be very helpful.
It is one suggestion from this for the thing from it is from this webinar. I told it to start to the authorities to mention RIV to get the trial or to implement things for a BDS Ayurveda course recently, very immediately. That is very recent. If it was started early, I think it will be very beneficial. It will be world standard we can reach in the dental surgery and medicine, Ayurveda. It is very too late, I think. Why so late? In Ayurveda, you read, I think it will be very thing I don't respect.
Sir, where is your
I can be, sir. I can be.
sir, where is your hospital at in Kerala?
What is?
Where is your hospital in Kerala? Which place?
Now it in Thrissur.
Yeah.
Thrissur.
Day before yesterday, I was in Thrissur.
Thrissur. When you come to Thrissur, meet me and
Sir,
meet our hospital and our patients also. You can see we are giving only simple medicine. That is one thing in right to my treatment. Not about 21 days or 30 days or 1 year. Not only 7 days. Only maximum treatment I am admitting is only for 14 days. Not for
Sir,
20 days. No. It's very economy. Very economy also. Not we are getting too much of money also.
Sir, day before yesterday, I was in Chaturthi.
Chaturthi, I know. I was also in PNNM Ayurveda College. I was there professor for 2 years in Chaturthi.
Oh, I delivered a lecture
About
on
15 years, about 10 years back. At
yes.
Chaturthi, PNNM Ayurveda College.
Oh, 25th, I delivered Vastikarma in children.
Vastikarma in children, I have not tried it.
Oh, in Chaturthi, just 2 days back, I delivered in seminar. Okay.
The
Thank you.
director of this Chaturthi Research Institute is my student in Vaidyanam Ayurveda College.
No, sir, now
He is one of my students.
Okay.
Research Institute director.
Yeah, director. Oh,
Director is my lean person. You might have seen him. He's also the
currently his
student.
name is Dr. Sudhakar. He is working, sir. Probably assistant director.
This is I mean you seen I think it's Kerala person that is mentioned. That's one person. You can see it's assistant director. I think.
VC Deep. VC Deep.
Okay.
VC Deep.
Deep. Deep is the person. VC Deep is my student in Vaidyanam Ayurveda College. He is doing so many lot of things.
Yeah.
He is doing a lot of things in Ayurveda. He has written some books also. He is All India very prominent member of the Ayurveda Association. Amai.
Okay, thank you. I'm very
Thank
happy,
you, sir.
sir.
Thank you, sir. Thank you. When you are coming to Delhi, we will see you and discuss any after the matter. Next thing, I will come to the Delhi.
Sure, visit RAV, sir. Positive.
Yes.
Sir, right now, Thrissur student is working under me.
Okay.
Anu Tony. Now, she is my Shishya.
Okay. Pardon. But name?
Right now, Anu Tony.
Anu Tommy. Now there is one Shishya from Himachal Pradesh, Shilpa Kumari is now with me.
Okay.
He is with me. Then another Shishya is from Kerala.
Okay.
Kerala, Trivandrum. Puja. I saw that two Shishyas coming here. I saw it made for my Shishya.
Okay, thank you so much, sir.
This was from Himachal Pradesh, Shilpa Kumari. Another is from Puja from Trivandrum.
Okay, very nice.
Here also better following my treatment. It's a typical special treatment. I am following and giving every treatment and without hiding anything. I am giving everything to Shishya. You can see. All this is eight time. I think it's a guru. I am all the 8 the Shishyas, 8 or 10 are doing everything. No problem. Nothing to be hide. Anything, anytime I will tell you. That is okay. Thank you.
Everybody.
Okay.
Are in the queue of ऊपर जाना. आप 76 हो गया, मैं 75 हो गया. जाने का टाइम हो गया ना ऊपर जाने का.
Now I am 76.
जो भी है गिफ्ट करके जाना.
ऊपर से ज्ञान गंगा का प्रसारण करिए, ज्ञान गंगा कार्यक्रम का ऊपर से भी.
ये महाराज फूंक निकलने के बाद कोई नहीं पूछने आएगा, सब जलाने के लिए तैयार होगा. जल्दी करो.
Okay.
अभी जब तक आपका सांस चल रहा है तब तक है, उसके बाद कुछ नहीं है।
Okay, okay, okay. Thank
हंसी
you.
भी नहीं आएगी आपको। अभी जो हंस रहे हैं, दांत दिखा रहे हैं, वो सब बंद हो जाएगा।
Okay, okay.
अरे आप
अच्छा,
तो-
अच्छा, अच्छा, धन्यवाद, धन्यवाद।
आप तो भरद्वाज
I
जी
should
हैं, आप
Okay.
सूर्य प्रकाश जी, आप भरद्वाज ऋषि हैं। भरद्वाज अमर है, अमरत्व को प्राप्त है। भरद्वाज हैं आप तो।
अरे नहीं
आप तो
महाराज।
भरद्वाज ऋषि हैं।
Surya
सुनो
Prakash is
भरत
the
भावी
grandman.
प्रबल, सुनो भरत भावी प्रबल, बिलक मुनिनाथ, हानि लाभ जीवन मरण जस जस विधिहार। ये सब
अच्छा,
परमात्मा
अच्छा।
चाहते हैं महाराज। जब रामचंद्र जी और कृष्ण भगवान नहीं रहे तो आप और हम क्या है? जो बांट देना बांट दीजिए, और
Okay,
उसके
okay,
बाद तो
बांट
जय ही है।
चलिए, बहुत बहुत धन्यवाद।
धन्यवाद, धन्यवाद, धन्यवाद,
प्रभु को
धन्यवाद,
शुभकामना।
धन्यवाद, धन्यवाद.
ओके, थैंक यू।
I shall
Thank
proceed
you.
with vote of thanks, sir. On behalf of the organizing committee, I would like to thank Dr. V. Sri Kumar, sir, for